Please welcome to the stage Dr. Felicia Marie Knaul from the University of Miami, Elisabeth Staudinger of Siemens Healthineers, and Her Excellency Dr. Zainab Shinkafi-Bagudu of the Medicaid Cancer Foundation.
Thank you so much for being with us, all of you, today. And we're especially grateful, of course, to Concordia, and the University of Miami is thrilled to partner with you, particularly in work on Latin America and, of course, on healthcare here today. Our session is dedicated to unveiling the patient's narrative, using the patient's narrative to illuminate the challenges and the opportunities to improving access along the care continuum. From the care continuum, what we're thinking about is everything that goes from prevention to palliation and in between, including diagnosis, treatment, and survivorship. Women face challenges that are specific to being women at every juncture in the care journey. And cancer, and specifically breast cancer, and I say that as one who has lived the disease and lives the sequelae of survivorship, provides a kind of key information as a tracer condition to understand health systems better. We're doing a significant amount of work on this on the Lancet Commission on Cancer and Health Systems, and I'm especially pleased to be able to be here with our two guests to be able to learn more and incorporate that into not only our work on cancer and women's cancer, but also to the idea of strengthening health systems overall. Let me start with you, Elisabeth. Access to care is a significant priority for Siemens Healthineers. And I know we share the vision, we all share the vision, that women's health is, and in some places should be, a priority for health, but also for equity, as well as being vital to economic prosperity. So why is it so important that we close the gender health gap and empower women around their own health?
So women are not just small men. And I think acknowledging this...
Especially me, is that what you're...
and I believe that's key to acknowledging that reality as we're thinking about how to create a healthcare system which serves both halves of the global population in an adequate way. And if you think about that, this statement I just made, it made you laugh, right? You say women are not just small men. But when you go a bit deeper and we look at how medicine is taught, how medicine is delivered, how medication has been tested for decades, that's exactly how the world looked at healthcare and for women. And then there is a second angle to all of this, and it's more than just delivering appropriate care to women, just like we would expect. But there is also a huge financial dimension. Women on average spend about 25% more of their lives in bad health. And this is not at the very end of their lives, as you might think, where you say, well, women live longer, so naturally maybe the last years of their lives are in worse health. It's actually during this range, during the productive years of a woman's life, where she, on average, just spends more time being not in a perfect situation. And that has implications for the women themselves, but also for economies, for society, for families. And addressing this, I believe, is a very, very important endeavor.
Elisabeth, thank you. We have some data that you may or may not be familiar with that really speaks to this issue, highlighting that statistic, 25% more time in bad health. The other is that we know that women are the majority of healthcare providers, both paid and unpaid. We contribute about 70% of the hours and the people that produce healthcare in our world. But our most recent data suggest that while the real value of women's time is about $5,000 per person, per woman who works in the health sector, which is all of us, formal and informal, we never get a chance to ever withdraw, extract, get access to that amount of healthcare, to get back the value that we are injecting into the health system. Her Excellency, and she told me I didn't have to say this, but I had to say it once, Zainab. So there are multiple myths and narratives around women's health. They need to be unveiled, they block access, they affect health systems. But breast and cervical cancer, again, they give us some very specific examples across the continuum, but also because they are a leading cause of death throughout the world. For women, a leading cause of death overall, but also a tremendous source not only of death and disability, but that 25% of lack of health care translates to an incredible burden, economic burden for health systems, and significant levels of impoverishment and catastrophe for women and their families and for generations to come. With that, let's talk a little bit about how, under your leadership, Medicaid Cancer Foundation and Medicaid Nigeria have implemented some truly critical strategies to enhance patient outcomes based on all sorts of pillars of access, advocacy, and patient support. Tell us a little bit about, from your experience, what are some of the key challenges that women face to accessing care when they have cancer along that continuum?
Well, thank you, Felicia. It's a pleasure to be here. I come from Nigeria, a low middle income country, a large country, and the Medicaid Foundation operates in the northern parts where it's quite a diverse country and the population of women are largely uneducated, not economically buoyant, and do not have enough access to healthcare generally. And when you talk about cancer, breast cancer is the leading cause, and the barriers that they face are multiple. First of all, the biggest barrier that we face is poor education, a lack of awareness, and then there are infrastructural challenges. Access to cancer care facilities, be it for screening or treatment, is not as ideal as it should be. When you look at the statistics, 68% of Nigerians live within 4 hours of a road travel to a cancer center. But it's very variable depending on the geographical location of the country that one is. So in the north, it's as much as 8 hours travel. And of course, the biggest issue is the financial inability to access these, to even travel. Then we have one that we don't often hear about or get enough research about, which is stigma. Stigmatization, stereotyping is huge when you look at the cancers. Cervical cancer, for example, is thought to be sexual or lack of being properly behaved issue. And so we have to unbundle all these misconceptions and myths, and even trying to prevent disease, things like vaccination is faced with a huge kickback, and a lot of work has to be put into education. Education is really the low-hanging fruit, and working at the grassroots so that we can spread our advocacy messages to the treetop is very, very important. It's also important to work with the policymakers and ensure that they are just as equally educated. Nigeria introduced the HPV vaccine after a very long advocacy efforts last year, and today 13 million girls have been vaccinated happily. However, we were faced with a lot of kickback, a lot of misinformation, because the vaccine targeted girls, and in that cultural context, anything you do with girls is seen to be a reproductive issue, and we're trying to reduce their reproductive rates and ability. Most of the misinformation came from healthcare workers that had not been properly educated. So when I say education, I don't mean the woman that is living in a village, I mean everybody, the healthcare workers, the nurses in the hospital, the legislators and the policymakers, so that they can understand what we're dealing with here, how serious the cancer burden in low middle income countries is, and then of course, how we can advocate for better funding, better policies, and more infrastructure that will reduce the burden.
And that gives me a perfect segment into thinking about the how and the role of technology, the second part of our conversation. So collaboration between technology providers and healthcare organizations can truly amplify our ability to close gaps and increase access. But we need to think about strategies. Simply increasing access to medicines is just not going to be enough. It's not going to solve the problems we're speaking about at the health system level or the issue of impoverishment. We have to support women across this continuum around the education aspect, and screening is not the only issue here. Now, COVID, the tragedy that it was to our world and to so many families and to individuals, also left us with one thing that we have to say is amazing, which is our new access to an ability to communicate, the technology of communication. And with that, Elisabeth, I want to ask you, I know innovation and digitalization are some things that are very important to the work that you do as an individual and in your role as a corporate leader. What role do digital tools play in closing these divides?
So digitalization and also that whole dimension of artificial intelligence, it's very cool stuff. And it's possibilities which will be able and are already today making a huge change to how we can reach out to people, how we can reach out to communities, but also how we deliver care and how accurate we can be about really understanding what is the issue a person is facing and then guiding the meaningful next step. So the more exactly you know what the problem is somebody is experiencing, the more targeted you can be in your decision making. And then there is also a big element, we spoke about cancer a lot, but also in other diseases, where digitalization also offers us opportunities to guide and accompany the care pathway of patients even after they emerge from that acute episode of being in a hospital or receiving direct medical care, because there is many, many things as we are going through our hopefully long lives where it's good to remain connected, and digitalization will be an important piece that can help us reach that ambition.
So important, and these are global lessons. As someone who works in Mexico on advocacy, hugely important. Let's turn to you and ask you a little bit about how digital tools can support better access.
Well, digital tools are really important. A lot of people now have access to mobile phones, and communication networks are constantly improving. To support access, we can use it for education, we can use it to do things like sending out reminders, and we can use it to dispel a lot of the misconceptions that I was talking about, using locally made and in the right context kits, messages, languages. That is important. We also are seeing a very huge surge in artificial intelligence, and artificial intelligence in cancer care is going to give us the opportunity in Africa, if we include models and data from the African subcontinent and others that are currently missing in these models, we will be able to have a quicker way of diagnosing and an easier way that allows us not to depend solely on the huge diagnostic equipment that can sometimes be expensive and not available in the interiors of the country. And then we also have, of course, digital technology. Telemedicine is extremely important, and one that will enable facilities to access expertise from high-income countries. There's a huge increase in that at the moment, and it's going to be really helpful if we do it in the right way and we ensure that everybody is carried along.
So we have about a minute left, and we're at Concordia. And Concordia offers us a chance to have collaborations between, let's call it the private for-profit sector and the private not-for-profit sector, civil society. Let's talk a little bit about partnerships. Zainab, let's start with you. Where do you see the potential for partnering between the for-profit and the not-for-profit or civil society sectors?
Oh, huge and no-brainer. There is a lot of collaboration, extending that hand. By coming together, we'll be able to influence governmental policies. The civil society are the often underlooked advocates that are on the ground in the communities and know how to relate messages. The private sector, on the other hand, have the funding that we need to drive these policies and interventions in health. And so by working together, the collaboration will be a win-win for all, and we can improve our outcomes generally.
Elisabeth, please.
So there is this saying, it takes a village to raise a child, and it takes a whole ecosystem of partners to come together to make a real difference and impact to patients. And for us, being able to reach out and partner with NGOs, but also government-related organizations, people who have insights and can make a difference is extremely important. Because we do understand we have one piece of the puzzle, but to really solve the whole thing, we have to bring together all the different stakeholders and join forces to truly make an impact and a difference for patients.
And this may seem easy, but as someone who works in advocacy, having these sorts of open, interactive conversations and partnerships is a real gift to the work that we do for women, for cancer, for breast cancer. And so we're very grateful for all of you and to Concordia for giving this space to helping women's health come forward in our world. Thank you very much.
Thank you for having us.
Thank you.